Hi, I'm Brian Finestein, CEO of St. Clare's Health. Welcome to Let's Talk Health. I'm here with Dr. Jeffrey Farkas, Director of Interventional Neuro Associates. We're here to talk about life-saving stroke care. And Dr. Farkas, welcome.
Thank you, Brian. Thank you for having me today.
Well, among the questions that our viewers are asking, there are over 800,000 patients who've undergone a stroke in the past year. What are the symptoms they should be looking for?
Great question. So before I describe what the common symptoms of a stroke are, I need to define what a stroke is. So in over 85% of patients, an acute stroke or a stroke is a damage to the brain. And that damage occurs because of a lack of blood flow going to the brain. The pipe that brings the blood flow to the brain, whether it's in the neck or whether it's in the brain itself, is clogged. And that is causing a neurological symptom. And the most common neurological symptom that most people recognize is weakness on one side of the body, but can have other types of symptoms as well, which include difficulty speaking, difficulty understanding speech, numbness, difficulty with swallowing. Now, I teach my patients when I see them in the office a mnemonic or an acronym called Be Fast. And what that stands for is the B is for balance, the E is for eyes or vision, if you have a sudden change in your vision, and that means usually visual loss. F is for face, so that if you see a drooping of the face, that's a sign of stroke. And A is for arm, so you hold out the arm like this, and if the arm doesn't work or it's not as strong as it was a minute ago, that's a sign of stroke. And S is for speech. And the last thing is time, T for time, which means it's a medical emergency. And the chances of getting better are when you go to the hospital as soon as possible.
Dr. Farkas, there are different types of strokes. Could you elaborate, please?
Yes. Overwhelmingly, we talked about strokes. There are blockage in the blood flow and a sudden reduction of blood flow to the brain. Mm-hmm. That's about 85% of strokes. About 15% of strokes are actually bleeding into the brain, where a blood vessel is weak, and then it opens up and then bleeds into the brain, and that's a different type of stroke. Mm-hmm. And I want to be clear, that is not the type of stroke that we treat with medications to open the blood vessel, because that would be opening up a blood vessel that's already bleeding. Mm-hmm. And while we have different tools and capabilities for treating those, using endovascular or inside the blood vessel techniques, we're not doing mechanical thrombectomy for these patients. But we're set up here and all at the different prime hospitals to evaluate, manage, and treat every one of those. Because if you come in to the hospital with that type of stroke and your blood pressure is 200, you're not managing that, and we don't get that down, then that stroke will be bigger. There will be more bleeding, and we can stop that. And if it's an aneurysm, mm-hmm. or if it's a malformation in the blood vessel, we can fix those as well using either neurosurgical techniques or endovascular techniques, or the combination to basically get those under control too. So when you're making a stroke center, it's not just about the ischemic strokes, it's about every patient with stroke. And even the patients who don't get the mechanical thrombectomy, and even the patients who don't get the TPA. It's about revolving the care around stroke, about everybody has it in their mind. What's the best thing to do for every stroke patient, period. So we treat every patient the best way we can, using the best treatments that we know how. And it's not only about the mechanical thrombectomy and the TPA, but it really revolves around the patient and how we can get their best outcomes.
Okay. Now, there's a term that is associated with stroke. Time is brain. Could you elaborate on that so our viewers understand?
So from the time that the stroke happens, the time that the blockage stops the blood flow to the brain, it really becomes a time factor. The longer the blood flow to the brain is reduced, the less chances that the patient is going to get better or make a recovery. Mm-hmm. So we say time is brain, meaning that if you have a stroke, every second counts. In fact, there have been studies that have looked at this, and about 1.9 million brain cells die every minute. So you can imagine how you really want to get to that hospital fast, and you want the doctors in the hospital, and you want the treatment to occur in a fast manner. And that's why we say time is brain.
Okay, thank you. You know, when we're talking about stroke, we're trying to emphasize people getting to the hospital. We're also suggesting that they go to a place that can handle advanced stroke care. What does it mean to the patient if they're going to a hospital that may not be equipped with that advanced stroke care?
So that's a great question. So because the stroke treatments are evolving over time and change over time, we now have a lot more tools in our chest to basically help patients. And so while we as physicians, Interventional Neuro Associates, and now at St. Clare's and all the different hospitals of Prime, New Jersey, now have the capability of treating every different type of stroke, not every hospital that's a primary stroke center can. So it's important to get to the hospital, and I want to make sure that you get to the nearest hospital. But not every hospital has the same capabilities, and today, the hospitals that don't have those capabilities end up seeing the patient in the emergency room, treating them as best as they can, and then sending them to hospitals that do have capabilities. And as we said before, time is brain. So that's a waste of time if we can bring the patients directly to the centers that can actually do the treatments that they need. But that's very variable, and patients don't look it up on the internet to see which ones have the capabilities. So it's important to understand the capabilities of the hospitals around you.
So the patient comes to the St. Clare's, to St. Michael's, St. Mary's, all part of Prime, New Jersey, because we're able to provide advanced stroke care. One of the terms that I've heard so that it's an alert for the physician is artificial intelligence. Can you talk about that technology for us, please?
Absolutely. Prime has invested in this software technology that allows us to screen every single patient who comes into the emergency room who gets imaging of their brain for what we call a large vessel stroke. And it does it automatically. So whether it's 2 o'clock in the afternoon or 2 o'clock in the morning, if you get this type of imaging done, the computer is automatically reading the scans and alerting physicians, hey, take a look at this one because this one might be a real deal, real big stroke. You need to get in and fix it. So it basically equalizes the coverage for the patient, and it also allows us to communicate with the physician seamlessly and as a whole group rather than just one at a time or a phone call here or a phone call here, activating the team to bring them in to take care of the patient as fast as possible. Some studies have shown that there's improvement in time using this technology up to 60 minutes. So if you save 60 minutes, that's a lot of brain cells.
Okay. Now, the gold standard seems to be the thrombectomy procedure. Could you talk about that?
So just to go back a little bit in history, in 1995, the first treatment for acute stroke was mechanical IV thrombolysis, which is giving TPA to a patient in the IV. So we discussed the reasons why, because there's a blood clot blocking the blood flow, and in order to try to relieve that blockage, we give a medicine that will break up blood clots and then hopefully restore the blood flow. That's called intravenous thrombolysis, and that is still a standard of care. And we do that for patients who show up into the emergency room within 4.5 hours, who have imaging characteristics of a stroke, who are candidates for it. There's a list of patient exclusions, but every patient is looked at by a physician and is looked to see that we can include them for the intravenous drug. But if you're not a candidate for that drug, for example, if you show up at 4 hours and 35 minutes after your stroke symptoms start, or if you have a blood thinner that you take on a daily basis, or if you had recent surgery, you can't get these medications. And then before mechanical thrombectomy, which is basically going inside the blood vessel and removing the clot mechanically, or going inside the pipe and going in and retrieving it, before that you didn't really have any other options. So only a small percentage of patients, maybe 3 to 5% of patients, were eligible for the TPA. And more importantly, if you get the TPA, the tissue plasminogen activator, the blood clot busting medication, it doesn't work all the time. So you might get the medicine and you might fall into the category, it didn't work for me, and then you're still stuck with the symptoms of stroke. So what we're doing today is In 2015, there were multiple trials, medical trials looking at this, and it came out to be that mechanical thrombectomy is the best chance people have at getting better when they're having a stroke. But it has to be done in an emergency setting. You can't wait 3 days and then get your treatment. You need to come to the hospital and you need to get your treatment right away. And if you come to the hospital and we use the AI and we look and we see that you're a candidate for mechanical thrombectomy, actually that's a good thing, because patients who get mechanical thrombectomy have a very good outcome compared to those who don't.
Now, that decision is not an elective decision. That's a decision that the patient presents themselves with stroke-like symptoms, and the physician is making that decision at the time.
Yeah, the patient comes to the emergency room. Oftentimes they can't even participate in their own care because they can't speak, they can't talk, they can't interact, and they don't have a wherewithal that they're actually even having a stroke. Family members come with the patient, and then we're set up to screen everybody with neurological symptoms for this, because you don't want to miss this, because this is that one opportunity to hit it out of the park and get that home run, or else you lose the game and it doesn't come back. So we're set up at all the prime hospitals now to basically screen everyone who comes in so that we can afford them the opportunity to get this treatment. And if they get this treatment, not everybody does perfectly, but the majority of patients will have a better outcome with this treatment than not.
Dr. Farkas, we've talked about the different forms that stroke may take. What are the recovery times?
So recovery is dependent on the degree of damage the patient has and how it's affected them, and what kind of treatments we perform for them. People ask me oftentimes after mechanical thrombectomy, where we go in and open the blood vessel, what kind of recovery patients have. Well, I have had patients who, right on the table, they couldn't move their arm and leg, and they're able to move their arm and leg immediately afterwards. And that's great, and that's what we live for. We want to have that. But the truth is, we measure outcomes based on what the studies have told us at 30 and 90 days. And what we look at when we look at the outcomes of patients who have had mechanical thrombectomy than those who haven't, that over 50% of those patients are in a better category, whether you're perfect or whether you're mildly impaired and you're still able to be at home rather than being in a nursing home, unable to care for yourself. So this is not only a treatment that can save lives, but it really saves your function. And I think that's so incredibly important, because what we strive to do as human beings is be able to function and do our daily activities.
Exactly.
And a stroke can happen in any age. And so it can knock people out of the workforce. It can make you dependent when you were independent. And that's very hard for people. So this type of treatment really gives people back the opportunities to have their lives. So I think that's an incredibly important fact.
You mentioned earlier about the symptoms, and you've talked about the different treatments that can be made. On an ongoing basis, are there any screenings that can be done so that the patient can be maybe more aware that they might be a candidate?
So I think that's an incredibly important question. So we know certain patients are at risk for stroke. For example, if you have atrial fibrillation, which is a heart abnormality where your heart isn't pumping the exact way it should be, then a lot of our patients are on blood thinners. But you need to be on those blood thinners, and you need to take those medications, and you need to get diagnosed with atrial fibrillation to get those medications. So it's really about overall good medical care. So if you go to the doctor and you check your cholesterol and you check your blood pressure, and and your risk factors are managed, and you don't smoke or you stop smoking, those are all incredibly important things to prevent you from seeing me at 2 o'clock in the morning in the emergency room. Once you're diagnosed with a stroke, we again look at all of those things. And we actually not only repair the stroke or try to go in and remove the blockage, but we also try to address the reason why there was a blockage and fix that. So we can fix the carotid artery if that's the problem. We have our cardiologists working with us on a routine basis to be able to help with the heart issues, so that it's a whole type of phenomenon. Because once you've had a stroke, you're at risk for another one at a higher level than the first time. So absolutely, getting into a care treatment is important.
Dr. Farkas, thank you for joining us.
Thank you for having me.
And again, thank you for joining us in Let's Talk Health. You can follow us additionally on Facebook or on our YouTube channel. And for more information, again, you can follow us on stclairs.com.